treating Stella today. I'm going to start by working on a sacrum and lower back, so I'm using a cranial osteopathic approach. Free up her pelvis, free up the sacrum within the hip bones, and normalise muscle tone. Palpate or feel where restrictions are. Nerve supply to lower back, and from the lower back and pelvis goes to the abdomen, so it's implicated in digestive disorders, poor bowel function, sluggish bowel, sometimes in colic, although that's normally more to do with the diaphragm and stomach, which is obviously higher up. Work up into the diaphragm, work on the chest at the same time. So often with children who've got, and babies that have got colic, often have a very restricted diaphragm. Poor diaphragmatic excursion leads to poor abdominal tone as well, often excessive tone, where everything's very tight. They're difficult to wind, difficult to burp, difficult to pass a bowel movement, which obviously leads to a lot of discomfort, a lot of distress, a lot of crying, a lot of misery. And there's diaphragms up here as well, that's there, and also in the pelvis. So we talk about the core link, which are the diaphragms, and there's also a diaphragm within the brain, which is the cranial dura. So I'm just working now on her upper back shoulder blades. Essentially releasing excessive tension. When babies have had a lot of compression, that compression is often held within the compression is often held within those tissues and stays there even months and years later. So you might have a child who's had a difficult delivery, had compression, stayed with them, and then they present maybe at 5, 6, 7 with migraine, headaches, can't sleep, problems at school, getting into trouble, can't concentrate. So I'll just slide you down. Just can move you around. Check where your head's going. There we go. Get a smile to your mum. So this is the bit that quite often children don't like, especially if they've got a lot of compression. I'm palpating over the front of the head, the sphenoid, and the back of the head, the occiput. Palpating, feeling what the neck is doing at the same time. A lot of delicate structures, obviously, not only within the head, but also the base of the skull. You've got the vertebral artery, the vagus, other cranial nerves coming out through an area just behind the ear. They can get impinged or nipped, compressed in delivery, especially if they have a lot of extension, if the head's tipped back a lot, or also been delivered. Or especially if they've not been delivered, they've just been compressed within the birth canal, they're not progressing. Just slide you down a bit as you're wriggling a lot. Brilliant. So keep you on the table. I'm just checking what's going on with the top of the head, the parietals, and the temporal bones, which are the ear bones, all of which get restricted with some deliveries. And within the head there's a vertical diaphragm called the falx, which is dura, which runs all the way down the spine. There's a horizontal membrane called the tentorium, which is also dura. So those membranes in the brain are linked in with structural problems lower down in the body through those other diaphragms.